Hi everyone, we are back with a new video in which we will talk about how to eliminate options when answering MCQs.
A 60-year-old man presents with sudden severe chest pain radiating to the back. Blood pressure is 195 by 110 milliliters mercury, heart rate 120 bpm. Chest X-ray shows widened mediastinum. What is the most appropriate next investigation? A. D-dimer. B. CT aortogram. C. Echocardiogram. D. Troponin. E. Stress ECG.
The first step is to identify the diagnosis clues. The key clues given here are sudden tearing chest pain, which radiates to the back, a widened mediastinum, hypertension. So all of these clues lead us to the diagnosis of aortic dissection. The second step is to remove irrelevant tests. The D-dimer is used for PE screening. The troponin I is for evaluation of a myocardial infarction. And the stress ECG is not appropriate here as it is not done in acute severe chest pain. So what we are left with are the CT aortogram and the echocardiogram. We've now eliminated three options. Now we come to step 3. Choose the best investigation. In stable patients, a CT aortogram is the gold standard. Echo is useful if the patient is unstable, but it is not the best option in this case. Therefore, the appropriate or the correct answer is option B, CT aortogram.
A 4-year-old child presents with drooling, stridor, fever, and sitting forward. What is the next best step? A. Throat examination with tongue depressor. B. Nebulized salbutamol. C. Immediate intubation in theater. D. Lateral neck X-ray. E. Oral antibiotics.
The first step here is to recognize what the emergency is. So the key clues given are drooling, tripod position, and stridor. And all these three lead us to the diagnosis of epiglottitis. In step 2, we will remove the dangerous actions. A tongue depressor exam can cause airway collapse, so we take it out. Oral antibiotics is necessary, but it is not the immediate management. Nebulized salbutamol is for asthma treatment. So we are left with immediate intubation in theater and lateral neck X-ray. And now we come to the final step where we apply the ABC priority. An airway threat always comes first, and we need to secure the airway here. As imaging delays airway management, we can very safely eliminate this option. Therefore, the correct answer would be option C, immediate intubation in theater.
A 25-year-old man presents after a head injury. He had loss of consciousness for 2 minutes and now has vomiting. What is the next step? A. Discharge home. B. CT head within 1 hour. C. Skull X-ray. D. Observation for 24 hours. E. MRI brain.
The first step here is to identify the key issues. This is a patient with loss of consciousness, vomiting in the background of head injury. The second step is to eliminate outdated or incorrect options. The skull X-ray is no longer recommended. MRI is not used in acute trauma, and discharge is unsafe. Therefore, we are left with CT head within 1 hour and observation. We come to step 3, where we choose the option according to the guideline. So according to the NICE guideline, this patient falls under the high risk category. Therefore, CT needs to be done within 1 hour. So the answer would be option B, CT head within 1 hour.
A trauma patient arrives with hypotension, distended neck veins, reduced breath sounds on the left, tracheal deviation. What is the immediate management? A. Chest X-ray. B. Needle decompression. C. IV fluids. D. CT chest. E. Pericardiocentesis.
The first step is to identify the diagnosis. Key clues: hypotension, raised JVP, absent breath sounds, and tracheal deviation all lead towards a diagnosis of tension pneumothorax. Step 2: apply the do not delay treatment rule. A chest x ray here would delay treatment. CT chest again is too slow. So we are left with needle decompression, IV fluids, and pericardiocentesis. Step 3: choose life saving intervention. We are dealing with a tension pneumothorax here. Therefore, the correct treatment is immediate needle decompression. Fluids are supportive treatment only. Therefore, the answer would be option B, needle decompression. So, the exam techniques used in answering these questions were: spot the diagnosis clue, remove unsafe options, remove non guideline investigations, and choose the intervention that follows ABCDE priority. The ultra fast MCQ elimination algorithm would be: first to read the stem, predict the answer before you look at the options, and eliminate quickly. Look for life threatening conditions, the key diagnostic clues, and guideline based management. Do check out the other videos in our channel. If you found this video useful, don't forget to like, share, and subscribe. See you soon.